Recommendations. 16. The recommendations from the review have been grouped by the 3 themes and considered in terms of the appropriate implementation timescale. Short-term actions that should be completed, alongside those to address delays and backlogs before the start of managed reassessment. The actions are focused on measures to increase assurance that PIP delivers the design principles and achieves the policy intent within the current model, whilst also delivering some improvements in claimant experience. Medium-term actions to improve evaluation of the accuracy and consistency of award outcomes, and to improve the collection of further evidence. These should be in place from the start of managed reassessment, and longer-term actions to redesign the PIP delivery model, both in terms of claimant experience and business effectiveness, probably implemented in phases. This should be planned before the start of managed reassessment. Improving the claimant experience. The department should, in the short term, 1. Revise external communications with claimants so that they understand what to expect at the assessment and to reinforce claimant rights and responsibilities. Page 49, paragraph 19. 2a. Redesign the structure and content of decision letters, and b. Review case manager training and guidance to strengthen decision letter writing skills and make sure quality checks take place. Page 50, paragraph 22. 3. Take action to begin a sustained programme to build better working relationships between case managers and health professionals. Page 52, paragraph 30. 4. Ensure assessment provider assessment rooms are configured so that the assessor and the claimant sit at a 90-degree angle. Page 48, paragraph 14. In the medium term, 5. Maximise the use of more proactive communications with claimants throughout the claims process. For example, greater use of outbound SMS messages. Page 47, paragraph 11. 6. Ensure that the policy intent for award review arrangements is being met and that guidance reflects this. And that decision letters provide a clear explanation of the rationale for review timings in individual cases, not using the language of interventions. Page 51, paragraph 24. In the longer term, 7. Review the PIP claims process, adopting a design that maximises the opportunities presented by greater use of digital and other technologies and can be implemented in a phased and progressive way which a. Gives high priority to the introduction of a mechanism, such as an online portal, that allows claimants to track the status of their claim. B. Moves away from a one-size-fits-all model for the claims process and supports a more tailored approach based on the needs of claimants. C. Uses contact with the claimant to identify what information and evidence may already be available to support the claim. D. Makes the claimant journey more integrated under common branding. Page 53, paragraph 38. Further evidence. The department should, in the short term, 8. For the face-to-face assessment, reinforce existing guidance for health professionals to ensure consistency in how they introduce themselves and the functional nature of the assessment, and limit the emphasis placed on collecting clinical information. Page 58, paragraph 25. In the medium term, 9. Explore opportunities for improving the collection of further evidence by A. Reviewing external communications so that messages about further evidence are consistent and give greater clarity about the type of evidence required and who is responsible for gathering the information. B. Where appropriate and relevant, sharing information and evidence from a work capability assessment or other sources of information held by the department. C. Examining the potential for wider sharing of information and evidence across assessments carried out in other parts of the public sector, for example, health and social care reports, page 56, paragraph 15. The effectiveness of the assessment. The department should, in the short term, 10. Monitor the application of Activity 11, Planning and Following Journeys, and ensure there is a clear explanation of the purpose of the activity for departmental staff, health professionals and claimants. Page 60, paragraph 9. 11. Review how aids and appliances are taken into account in PIP assessments against original policy intent and make any necessary adjustments to guidance and training. Page 61, paragraph 12. 12. Ensure the consistent application of existing guidance for health professionals on reliability and fluctuating conditions. Page 62, paragraph 16. In the medium term, 13. Put in place and announce a rigorous quantitative and qualitative evaluation strategy with a scheduled plan for the publication of findings, which includes a priority focus on the effectiveness of PIP assessments for people with a mental health condition or learning disability. Page 63, paragraph 22. 14. Provide assurance of fair and consistent PIP award outcomes by supplementing existing vertical quality assurance with the assessment of horizontal consistency. Page 64, paragraph 25.